Hello, everybody. Welcome to our fourth episode of Just Birth. We've had some delays due to baby and then some delays due to technical difficulties just now, but we are all here on the call and really excited to talk about this important topic. So this is Just Birth. This is a monthly roundtable discussion series that Doula Canada hosts to talk about issues related to birth equity and social justice within birth work. And we invite guests largely drawn from our own membership, our students and alumni of our programs, who have lived experience of different issues that are relevant to the health equity needs of birthing people. So today we're going to talk about issues and challenges faced by people living in rural and remote communities, and how doulas support people in that context. And we're going to get some perspectives from our members as to how the systems through which this care is delivered could be improved to make that care more equitable, safe, and supportive of the well-being of birthing people in rural communities. So I'm going to introduce the guests we have with us today. So first we have with us Sam Whitman. Okay, so Sam Whitman, who uses she, her pronouns, is a birth and postpartum doula and a chest feeding and menopause support person working in central Newfoundland. She also operates an organic farm, micro farm, along with her partner and son. The limited options for both her clients and during her own birth experience showed how essential it is to support families in every capacity, no matter their geographical location. Families in rural Newfoundland sometimes are having to travel hours from their homes to access pre- and postpartum care and birth support. This is particularly an issue for Indigenous communities in Labrador who are being evacuated from their homes, families, and communities for weeks leading up to their birth. Sam is honored to be able to support families in any way she can and to advocate for systemic change in her community, in her province. Okay, and we also have joining us Melina. Melina joins us from Teleyoik, Nunavut. She's been living there since 2018. She's been certifying and working as a doula there for over a year. She loves what she does and thinks that more people in Canada should be aware of what birth and postpartum care looks like in isolated fly-in communities in the north. And we also have with us Stephanie Michelle. Stephanie is from the, can you please, Stephanie, say the name of your nation? Because I'm going to get it wrong.
And Silk.
Okay, so she's from those nations in British Columbia. She currently resides in Merritt, BC with her three children. Her three children who are all under the age of 8. Over 2 years ago, Stephanie began her journey as a certified birth worker. As a mother of 3 children, she understands the amount of support birthing people need. She also understands that accessing support could be challenging for people in rural communities and Indigenous villages. Stephanie has experienced these challenges when she gave birth to her 2 youngest children. Stephanie is committed to supporting her community and the people who require it the most. She feels that her work as a doula is valuable and needed in the community that she calls home. Okay, so thank you all of you so much for being with us here today. So I'm just going to be real about the fact that I am a city girl. I have lived I'm currently in Toronto. That's where I'm located, and I've lived in Toronto my entire life. The knowledge that I began to acquire of the disparities in the rural setting came from getting to know my wife and my in-laws, who live in a small town in Northern Ontario. And as they have aged over the years, I've seen what their challenges have been like with accessing stable healthcare. But I'm very excited to hear from all of you about how you've seen this play out in the birth space. So as we know, one of a labor and birth doula's roles is to provide continuous support during labor. I was wondering if you could all walk us through how you provide this kind of support when both you and the client are far away from the hospital.
I'll start if that's okay with everyone.
Yeah, go for it.
So as of right now, I'm actually visiting Ontario. So what you see is not my house in Tillooyuak. I'm on holidays right now, but I am visiting in Ontario. But anyways, in Nunavut, where I'm from, we only have one hospital in the entire territory, and that is in Iqaluit. So if you are not located near or around Iqaluit, you have a hub, depending on which part of Nunavut you are located in. For me, my region's hub is Yellowknife. So what care looks like, since no one actually gives birth in the territory unless you are near Iqaluit. You fly out to Yellowknife at 36 weeks gestation, and you wait in your hotel room until you have signs that you're in labor, or unless you have a scheduled C-section or are scheduled to be induced. And then you wait in the hotel room with your one escort. They just started allowing escorts for birth 5 years ago. Up until then, you would go alone. So you fly out at 36 weeks with an escort of your choice. You sit in a hotel room and you wait. And usually my role, since I cannot go with them, because usually they bring a parent or their partner, of course, my role is very virtual up until they give birth and then return home within a day, sometimes a week, depending on how the birth was. So whether we're on the phone the entire time, or we're on Zoom, or we're on like Facebook Messenger, my care is very virtual up until 36 weeks until they return.
Thank you for sharing that, Melina. I guess the access to virtual support has increased options for some people. Sam or Stephanie, would you like to share a little bit about how you structure your practice in your communities?
Yeah, I can go. So I just like to acknowledge that I'm here on the Nunavut and Silk territories. This is where I do most of my work in this area, Merritt, BC, and the surrounding Indigenous communities. So there's 8 or 10 Indigenous communities, and so a lot of my clients are Indigenous and already isolated from the town Merritt. And also Merritt doesn't have a functioning maternity ward anymore. So we have to travel to Kamloops or Kelowna. Those are the closest cities next to us where we can birth our babies in a proper hospital with all the equipment needed. And so usually what I do is I offer virtual support over the phone, messages, and prenatal care. I'll visit them in their home, or we'll meet somewhere. But it's usually done through virtual. And then when they do give birth, I will meet them at the hospital usually. I have never attended a home birth as a doula yet, so I've never experienced that. But for myself, I gave birth here in my community, in the Indigenous community in Newfoundland. It's called Newfoundland. And so when we did that, I had my doula, and she was going to travel to see me whenever I was going to call her. But when it came down to it, I didn't ask her to come because I was more scared of COVID. And so she didn't come, but that's how it is for us over here in Merritt, BC. Yeah.
Thank you so much for that, Stephanie. Of course, I have follow-up questions for both of you, but I would like to hear from Sam first and her perspective on things in Newfoundland.
Sure, yeah. So for me and my clients, usually there's a big piece that goes into the prenatal education. So a lot of what I teach and a lot of what I share has to do with what to expect. And we have long discussions about when is the appropriate time to go into the hospital, because there's this kind of conflict between going in too early and then potentially stalling out your labor, or going in too late and potentially being on the road when you're in really intense active labor. So those are some some parts of the discussion that happens beforehand. Once labor starts, I'm in pretty consistent communication with them, either by phone or by text. And then once they're what we think is in active labor, or when they feel like they need support, I'll meet them at the hospital. So it's really just a kind of balance of really judging how fast things are moving compared to how far we all have to travel. Sometimes that's we're coming from different sides of the hospital, and sometimes we're closer together at the start. But for the most part, I just meet people at the hospital when things are moving along. Sometimes it ends up being a little bit too early, and it becomes a really long birth support. And sometimes I show up and it's almost a little bit too late. I haven't actually missed a birth yet, but that's always a concern for everybody, especially when we're coming from opposite sides of wherever the hospital is. That's me.
Okay, so 3 similar but different stories about how things are looking in different places, with Melina being somewhere where folks have to fly, like, basically birth evacuation policy that we've talked about on our platforms, and I think many of our members are aware, but just for anybody who's listening who doesn't know about this. So for people in situations like Nunavut, where they are not at all close to a hospital, as they're approaching full term, Health Canada has a policy that requires people to be in a community where they are closer to a hospital, and in the event that they go into labor anytime after their 36th week of pregnancy. This policy disproportionately impacts Indigenous communities, but also other people living in geographical regions where this becomes an issue. And I know that there's lots of conversations about initiatives that could be done to make it possible for people to birth closer to home. I was wondering if, and Stephanie, you mentioned that you did end up birthing one of your children. I'm not quite clear if you birthed one of your children or all of your children within your community. I was wondering if you could tell us a little bit more about that and how that was facilitated. And then I would love to hear from all of you your thoughts as to, is there a workaround for the logistical challenges that you've just described?
Okay, so for my second child, I had a midwife and I opted to birth at home, but because of some health issues, the midwife said that I needed to birth in a hospital, in a hotel room. So I had a home birth in a hotel room so that we were close to the hospital in case there was anything that was going to happen. They wanted me there. So everything went smoothly. I had my baby in the hotel room, and it was really actually good. It was a good experience. I was able to have the birth pool in there too, and family. So I had my family all in one room, and then I was in another room. So I don't know if you know that Indigenous families usually have like all our family around. We were able to do that. And then with my third child, my baby, he's 2, I opted to have another home birth. And so this time my midwife, the same midwife, she felt comfortable with my health conditions, and we were able to birth at home in my community where there hasn't been a home birth in decades. So it's been a really long time that there has been birth back at home. So bringing the birth, back home into our Indigenous communities has been really awesome. Just to have my baby here on the Ntlaka'pamux territory was really special for me and for my family and for my community. So we had my midwife there, and she had her helper. And when the time came, they asked me to go into the midwife clinic. So I had to travel from my home in Noaich to Kamloops, which is an hour. And she thought for some reason I was in Kamloops. So I traveled an hour in early labor And then she's like, okay, you're in labor. Do you want to stay here in Kamloops or do you want to go back home? I was like, I'm going back home. And so I traveled all the way back home, like ready to have my baby. And we got back to the house, and I was able to, get as comfortable as I can in our home. And because we were in isolation and it was early, it was like right after we went into lockdown. So I didn't have much people around. I didn't have too many family there. It was just small, intimate, and just my mom and my dad and my two midwives. So yeah, that's my experience.
Right. That sounds so beautiful. Thank you for sharing that, Stephanie. And that's a really empowering story too, just given some of the challenges that we've heard about bringing birth more into like locally into rural communities, and particularly back into Indigenous communities, so that you can have things that aren't really easy to facilitate in the hospital, like all of the family gathered round and so on. Melina and Samantha, do you guys have any thoughts on what would be involved where you live in supporting people to have the kind of experience that Stephanie just described?
As of right now, it's trying to work with the government, which isn't always the easiest thing to do. I am also a public member of the Nunavut Midwifery Registry Committee, and basically what we are working towards is being able to give birth, if not in your community, at least in your region, so you don't have to fly outside of your home. So the capital of my region is Cambridge Bay, and they used to have a functioning birth center, but due to staff shortages and lack of funding, because prenatal budgets always seem to get cut first. It's just an honest truth here, unfortunately. That birthing center closed down, and there was also another birthing center in a different region in Rankin Inlet, but again, closed down due to lack of staffing. So trying to get the funding and midwives who have either worked in Nunavut or worked in isolated communities who understand how different birth works here. And then kind of the long-term goal is being able to give birth traditionally. So in the summer, spring, fall, sealskin tents, and then also in early spring and winter in igloos on the land. And there are still people living in my community who were born on the land and remember growing up on the land, because Nunavut was colonized in the 1950s and 1960s, so it's still relatively new. So I've been able to speak with elders and speak with people who grew up on the land and remember bringing their mom like new clothes for her igloo and moments like that. So being able to bring that back is super important to me, and the committee, we're working towards it, but it's going to take a lot of time, but definitely worth it. And I hope we can get at least births back into Nunavut within the next 5 years, if not sooner.
That sounds like amazing work to, and it sounds like midwifery is kind of the backbone of the plan of how some of this could be local. Sam, I'm wondering if you can tell us a little bit about what you've seen in Newfoundland in that regard, because I know that you're very involved in trying to get better midwifery access there as well.
Yeah, so midwifery was put under legislation here in Newfoundland a number of years ago, but that actually limited access to midwifery care. So up until a couple of years ago, we had no midwives working in the province. And then we were able to start a clinic here in Gander. And we have some pretty amazing and incredible midwives that are working there, although it is not without its challenges. So the hospital in Gander has had to close their obstetrics unit a number of times since the midwifery program has started, which means that the midwives don't have obstetric support. So people are still either having to birth at home, but with obstetric backup being hours away, or they need to go and still have a hospital birth with either family doctors or obstetricians supporting them. So we kind of do like 2 steps forward and then 3 steps back, and then 1 step forward and 2 steps back. And things are challenging for sure for a number of reasons, but it's really dire that we keep supporting our midwives, and that the obstetricians and the obstetric units and the nurses and the government all kind of come together to really support that, so that people have options. Right now, it's very limited in the options that people have, and people are having to travel a really far way to get the support that they don't necessarily want to be choosing. So yeah, so there's lots of things that can be done, and hopefully some steps that are making some progress in the very near future. But we need to keep working at it, and we need some more collaboration with all levels of the health authorities and the government as well.
Thank you for sharing that, Sam. Of course, I have lots of questions in response to what you've all shared. I guess I have to confess, I can't help my mind from going, Sam, to the place where you're talking about either people have to, if they can get the midwife in the one community where that's available, they either have to make the choice between having the home birth and being hours away from the hospital, or just decide they're going hours away from the outset. I have to wonder, for the people that decide they're doing this at home, have there been tragedies associated with that decision? Like, I guess I would just be like, oh my gosh, what if I decide to have this home birth thinking that it's going to go fine, and then it doesn't, and I'm not close to the hospital?
Right. So far as I know, all of the births have had wonderful outcomes. The number of home births has been fairly limited even since the beginning of the program, when they had the obstetric unit open in Gander. But their outcomes and their results have been incredible, and they are working with low-risk families and low-risk pregnancies. So there's a lower concern to begin with, but I know even the midwives are having concerns about being so far away from obstetric support, because they know that things can go wrong, and they want to know that they've got that support, and right now they don't have it, which is a huge challenge for everyone.
Stephanie, I'm curious about, in your situation, you said that the birth that you had at home in your community was like the first time that had happened in decades. Was that the start of a trend? Have like more people said, oh, this is like something that we can do, and it's sort of becoming more common?
I know in the Indigenous community, it's not really becoming anything yet. I know a lot of people are inspired by it. But also I think they have the fear that they're that far away from, a hospital if anything was going to happen. So, I did have that fear as well, but I really felt like that I needed to be on my land and to give birth to my baby here. So that outweighed the fear. So I hope that it becomes more of something that the Indigenous community or the people in Merritt would like to do, is birth more here at home, and to access more midwives. It doesn't seem like some people know what midwives are, or the difference, and so so where I work right now is I'm the prenatal coordinator, so I am getting the information out there to people, what the difference is between a doctor and a midwife, and yeah.
Thank you. You've also, I think, all touched on the importance of education and like really making sure that like with the constraints that people are under, a huge part of the work that you do is letting people be aware of the options that they have within those constraints. Melina, I'm curious about hearing from you, because your story is that like people are not just a long drive from the hospital, they're a flight away from the hospital. So if you were taking on the risks of birthing closer to your community and it wasn't going well, what would plan B look like in that situation?
So yeah, we've had this discussion on the committee as well. And plan B, if something does go wrong, either if it's something that the community's health center is equipped for. The health center in my community is fairly new. It was built within the last 5 years. We have a great nursing staff right now, but if it's something we just don't have the equipment for, then the only option would be a medevac.
Okay.
Yeah.
Okay. Mm-hmm. And how easy is that to access?
So we use medevacs in the community all the time, from everything
Mhm.
from broken legs to birth.
Mm,
And a lot of it is the medevac going to get here in time? There is an
mm,
instance last year where there was fog, so the medevac couldn't get there in time.
mm,
So we had a baby born in the health center, which was not planned, but it was the
mhm,
safest thing that could happen.
mm,
There was another case, one of my wife's former students, actually, when her mom, she's now 20, when her mom was in labor with her, she was literally crowning, and the nurses said, you have to wait for the medevac. And they physically pushed the baby's head back inside of her because
oh,
you can't give birth in the community. It's not safe, but this is safe, right?
oh
And so the
boy.
right. So the medevac got there within the next like 5-10 minutes, but they literally forced her to, because you can control that, right? When you feel like you have to
Oh
push,
my
you can just
gosh,
turn that
sure.
off. So
Oh,
exactly. So we're not too far removed from that situation, because again, you're on
mhm,
the time of the medevac or the time of the
mhm,
staff. It
mhm,
has, yeah,
hmm,
yeah, it's kind of
hmm.
upsetting that you almost lose bodily autonomy even while you're in labor.
I
I know,
mean, we hear so many stories of people losing bodily autonomy. It seems like,
Yeah,
especially when they're in labor.
yeah, and that's not just a isolation thing. That's
Yeah,
happens
yeah.
everywhere, unfortunately.
That's why we do
I
this show. Sam, you
I
were
know there,
gonna.
yeah, I know there are some midwifery practices around the country as well, where midwives can do some extra training and become second for cesarean surgeries,
Mm, mhm,
which really opens up a lot of opportunity,
mhm,
especially if the family doctors or the physicians that are on call are able to do those kinds of births.
mhm,
It really opens up the opportunity for that as well.
mhm. Thank you for bringing that option into the mix, because I know that I don't know how this works in every province, but here in Ontario, what each health profession can do is regulated by a controlled acts model. And there's a process whereby certain controlled acts can be delegated to providers who wouldn't normally have that within scope. So, Sam, it sounds like you're describing programs that kind of leverage that mechanism, where now a provider who does have it in scope to do the cesarean section can kind of support another provider to build that capacity. So I think that these are all great ideas. The other theme that I'm noticing in all of your stories is that there's a lot of anxiety about birthing when you're far away from the hospital. But you've all told stories about people doing it, including yourself, Stephanie, and having that go perfectly well. So I'm just sort of like, what are your thoughts as to like, do we have an inflated idea of how risky it is to have a baby without all of the bells and whistles that the hospital has to offer?
I think that's part of um, the fear that's imposed on birthing families and birthing people, um, is that it's not an option to birth away or far from a hospital because there are all these risks. But what's not taken into account is the risks associated with being away from your family, being away from your community, having to travel while you're in labor, or having to potentially birth while you're en route to the hospital. So um, there's the risks associated with being away from the hospital and the services that accompany that. I feel like they're blown a little bit out of proportion, so that the fear that comes along with not birthing, or the fear that comes with birthing away from home, is kind of silenced a little bit. You're muted, Kara.
Sorry about that. Thank you for that, Sam. I think that that point about the risk and the benefits of either option is a really important piece, because we focus so much on the risks of not being close to the hospital without looking at the risks and the benefits of staying closer to your community as well. Stephanie and Melina, do you have any thoughts on that from within your own communities?
There's definitely more of the younger generation who are very much interested in bringing birth back into the communities and onto the land, and bringing back a lot of the like traditions of shamanism as well, because along with colonization came Catholicism, and it's still very prevalent and very new. But the younger generation, specifically the teenagers, are very much like, how can we get this going? But at the same time, to give birth at home, Nunavut's in a housing crisis right now. So sometimes you have families of 10 living in a 1-bedroom while sharing multiple mattresses on the floor. So wanting to have a home birth sometimes at home just isn't possible, because either overcrowding or cleanliness. So we also have to get the government to work hand in hand with building more houses, because there's just so many excuses right now as to why we can't. So it's almost like the better option would be to give birth on the land where it's less crowded. When you're building the tent and building the igloo yourself, you know where all those materials and resources came from. And also just being with nature. Like, I have been out on the land in Talrock, and it is the most beautiful, the most peaceful, and that would be a wonderful place to be able to give birth, much like their grandparents and great grandparents did. So definitely seeing that from the younger generation will hopefully get things on the midwifery committee moving even more, having their voices and their input.
Thank you, Melina. Stephanie, do you have any thoughts on this sort of tension between fear of not being close to the hospital, but also all of the risks associated with leaving your community?
Yeah, so I feel like that in the Indigenous community, we're missing the traditional part of birthing very much. And to hear that Nunavut people are, having that within their birthing experience is really inspiring for me. And so I feel that, it's part of my work here as an Indigenous person to bring that back to our people. And so if I can bring that to them, then that's part of their home, wherever they're going to birth. And so I feel that that's really important in my work as an Indigenous person. So yeah, thank you. I feel really inspired by this talk.
Yeah, 100%. I agree. Absolutely supporting people to implement those traditions, whether birth is happening at home or the hospital or wherever it's happening. This has been really, really, I agree, Stephanie, very inspiring. And I think just really in terms of dreaming and envisioning a world where there are solutions, and actually it is possible to do things differently than what we accept as the norm. We've talked a lot today about what things look like for the actual process of giving birth. I'm curious as to what happens after people have their babies when they are in a rural community. Are there any particular postpartum challenges that arise for people?
There are many postpartum challenges. I can only speak from my experience, of course. But when they fly back after giving birth, all follow-up appointments with the nurses are for the baby only. There is absolutely no postpartum care at all. And until I came in a year and a half ago almost, and was trying to explain, like, this is what's happening to your body. This is why you might feel this way. Everything from like postpartum bleeding to colostrum and milk coming in. There's just a lack of resources and a lack of education, and years of the government making sure that the Inuit stayed silenced. And so not being able to advocate for themselves or fully understand, and just the lack of education. And we can really only blame the education system for that, and for also like having their voices taken away, and for so many years. And so trying to reclaim that and it's okay to ask questions. You shouldn't be embarrassed about your body, because there's so much shame and so much embarrassment. So I'm really grateful that my community accepted me the way that they did, in terms of people who were afraid to say the words breasts and vagina 2 years ago are now asking me questions with words I never thought I'd hear come out of their mouths. So I'm just so grateful that my community offered me a position with the Hamlet, and has offered me space in the health center, and offered me safe places in my community to have the postpartum discussion, because there was no postpartum discussion at all. It was kind of, you're on your own. And the healing process is also hard if we go back to the housing crisis and the lack of housing. How are you supposed to heal like in a healthy environment when the houses are not a healthy environment, whether it's mold or whether it's the RCMP kicking the front door down and not replacing it, so you have a tarp as your front door? Like, these are issues that need to be fixed if we want the postpartum period to be something enjoyable, to a point. Obviously, I know it's not, but for it to be comfortable and enjoyable, and for you to feel comfortable in your own skin and not be embarrassed and not be ashamed. So I'm now glad that we have that safe space in my community, at least, and I hope my entire territory soon.
Thanks, Melina. Stephanie, do you have any thoughts on how rurality, living in a Indigenous village, impacts that postpartum journey?
Yeah, so here in Merritt, some of the services that are provided aren't actually here in Merritt. We have to travel to go to it, especially with like lactation support. So we don't actually have a lactation counselor here in Merritt. You have to go out of town. So I know that is a challenge for some people, because a lot of the parents that I have worked with have challenges with breastfeeding, and we don't have the proper support here for people who are looking for that proper support. So it is a challenge. And then also the people that need the support, they don't have vehicles, or they don't have a way of transportation to get to these places. So they just don't look for that kind of support, and they really need it, because I hear it, I'm here for them, and they reach out to me, and I try to help them as best as I can, but it is challenging since we don't have that kind of support here. But we do our best, and hopefully that we do get more supports here in Merritt instead of driving out of town. So yeah, I think that's all I have right now. Thank you.
That's great. I'm going to loop back to that, but I'd like to hear from Sam first about what postpartum looks like for folks in central Newfoundland.
Well, all across Newfoundland and Labrador, postpartum mood disorders are a major issue. So we have some of the highest postpartum depression rates in the country. And mental health support in general is really lacking. And is very centralized to the larger communities. Breastfeeding and chest feeding support is also a huge issue. So because people are so far from their homes, a lot of people are kind of in a rush to get out of the hospital and get back home, especially if they have other little ones who are waiting for them at home. So for a lot of people, it's easier to just say that they're going to formula feed so that they can get discharged from the hospital sooner. And this was a huge issue, especially when COVID was first starting, and there was no support people allowed in the hospital with them. So people were just in such a rush to get out of the hospital that they would jump and say that they were going to formula feed, and then there was no breastfeeding or chest feeding support for them once they got out, or they weren't able to initiate it in the first place. So those are two of some of the bigger issues, but it's definitely not an exhaustive list of the issues that people are facing, and in all across this province too. It's not just in the rural communities, but even in the larger centers as well.
Okay, so so much to unpack there. So I'm observing what several of you have said about breastfeeding supports and the challenges accessing that, and as well as the challenges accessing virtual supports. So I can't help but think that, like, one of the things we've learned through the pandemic is that a lot of this care can happen virtually. You guys, some of you all actually, I think, talked about virtual support being at least part of the work that you do as well. Do you feel like we could keep some of this post-pandemic? Like, I know some IVLCs who have been doing virtual lactation support. Is that something that would help your communities, or are there, other challenges that wouldn't alleviate? Therapy too is another thing that, virtual options have really expanded what's available to people. So I'm wondering if those types of resources would make a difference in your communities.
I think it would help, but it's not going to fix it. So having access to resources obviously is going to help make things a little bit easier and a little bit better for families. But virtual support is not going to fix all of the problems that we have, especially when you're looking at breastfeeding support or chest feeding support. Sometimes you just need that hands-on, this is how you do it, this is what needs to happen, this is how you hold your baby. Like, for people who don't know how to hold their baby when they're trying to feed at the chest, somebody talking to them over Zoom isn't going to fix that. So absolutely, virtual support and virtual resources are important, and they definitely have a place, but it's not a fix. You're muted again, Kara.
Oh boy, 2 years in and Zoom is still giving me trouble. Stephanie, Melina, would you like to add to Sam's thoughts on that?
I 100% agree. Virtual it's not going to fix the problem. You can only do so much when you can't physically help someone, like place their hands or help them if they have a clogged duct. You can only do so much. I also did my chest feeding through Doula Canada, so I've been lucky enough to be able to bring that into my postpartum clients as well. And again, like Stephanie was saying, because of the lack of resources, it's like, I'm just going to formula feed because it's easier. Our prenatal postpartum nurse is so lovely, but she was like, listen, I know nothing about breastfeeding. So she kind of had open arms and said, what can you show me? So we've been working together on that to try and bring breastfeeding. Breast isn't always best. I think that a fed baby is the best baby, but also just in terms of how expensive formula is here, because almost all of the food gets flown in on food planes, and then a barge ship comes up once a year. As of right now, the cans of Nestle Good Start are $75, and that's for one can. That's for the largest size, and then depending on the brands, like the Ethamil, I think is $55 for one. So they're never less than at least $45. And so we're trying to bring your face right now. Exactly. Right. Exactly. So just trying to bring in breastfeeding, not just for the obviously health reasons, but also for to save money reasons. But again, I think we need more lactation support, because the closest lactation support is in Yellowknife. So no matter what, you have to take a plane. And like we said before, there's only so much you can do virtually like this.
Stephanie, do you want to add to this piece?
Can you ask that question again? What was it that?
Yeah, I'm wondering how much virtual supports could alleviate this, or what other resources you think could make it more possible for people, because it sounds like at this point for some of you it's really just not feasible for your clients to access something like a lactation consultant. What could happen to make that feasible?
So here in Merritt, we have different like groups for mothers. So we have like a Merritt where I work, it's called Merritt Moms and Families. And since COVID has, restrictions have lifted, we're able to have people come in here. So having more mothers coming in and being together, I think that's a huge support for the community, is just for, mothers being with other mothers and being around each other, and just being in the presence of people who are the same, right? Breastfeeding, chest feeding, with babies, children, mothers, fathers, grandmothers. So having that community support is really helpful, especially when some people are isolated and they don't have anybody, or they don't want to see anybody. Some of them don't even want to come in because of just still being around people, right? I think people are still, I think people have fear of being in crowds too. So we still offer virtual support to some of our clients, and just having like a support group like this, I think really does something helpful for our community, our birthing community. So I think that is a big part and a resource here in Merritt, and that's how we help our community. But yeah, I also agree that virtual support can only do so much. So having people come into the community, hopefully, maybe if it will happen in the near future or whatever, if they can have someone come here, like once a week or something, just yeah.
That makes so much sense. I see that somebody in the chat has commented that another challenge with virtual support, or another limitation, I guess, is that the incorporation of traditional loss ceremonies is delicate. And of course, facilitating that on a Zoom call doesn't really sound very feasible as well. So that's a great piece to capture. And I loved, Stephanie, your thoughts around having sort of itinerant people being able to come in on an intermittent basis to come into those communities. And I also loved your thoughts around how we could better leverage peer support and like the resources that are already within communities. Last year, I shared on our platforms a study about a model in the United States where I think lactation consultants train peers within the community so that they can go and be lactation champions with their own community members. So I think that's a great model to bring into the mix. I wish we could keep talking about this, folks. I feel like there needs to be a part 2 to this conversation, because there's so much more to flesh out, everything that Melina was saying about housing, and that, of course, if you don't have stable housing, that's connected to other systems. And I'm so glad that we create this space regularly now to have these dialogues. And I am very, very grateful to Samantha, Melina, and Stephanie for joining us today to talk about what giving birth and the postpartum period is like in their communities. Please feel free to add questions to the chat if you want to keep the discussion going, and we can follow up on them that way. And please stay tuned for further episodes of our roundtable discussion series. We will be taking a break in July and August, and then coming back in September, because obviously there is so much more to say and talk about. All right. Thank you so much, everyone. Have a great rest of the day.
See you. Thanks.